We are live.
Congratulations to ourselves for continuing this every Sunday. And this is probably we have lost count actually, Anirudh, which number is this? But I think it is the 16th one or the 17th. But when you lose count, that means you are
It's
in the
24th.
issue. It's
It's
24th.
24th.
It's 24th. And when you lose count, which means that you're in a trance state, you forget how many you have conducted. The important is that the journey is very important and the present is very important. Shashank, we titled this U-turns, V-turns, left turns, right turns. And across 6 months, you have seen this happening with the WHO, with the CDC, with the government and the states on different issues, on sanitization, on protection, on medications, on hospitals, on policies. Uh, if you can highlight two major U-turns and what are the learnings across the last 6 months, Dr. Shang? And by the way, let me congratulate you for the articles in the Indian Express. People who have not read it, just type his name and write New Indian Express, and you'll find the articles. The last article was about very simple things, and I got a lot of feedback on my WhatsApp that very simply explained. Yes, Shashank.
So thank you, Guru Anna, for that. This is a lot of U-turns, V-turns, which we saw. The main thing, which are, if I have to summarize as two major changes. One was this virus being predictably unpredictable. The first flip-flop, which came from WHO, is it initially when the pandemic panned out, said there is no need to do masking. And now they have gone through a 360-degree circle and they say masking is mandatory because they have understood, and I always believed that this virus was micro droplet airborne because we live in Mumbai city in a urban jungle and in closed, ventilated, crowded spaces. And therefore, the likelihood of transmission of this virus was very high. And that is why Mumbai was actually one of the big hotspots in India. And that is why the first flip-flop was that we understood that this virus is spread through micro droplets of the air. The large droplets are important and masking is mandatory, and you need to use an N95 mask 24/7 whenever you are in touch with any other human being. So this was the first learning, and that was the first flip-flop. The second was that there was basically the locking. This word locking people hate. But is locking going to be useful or not going to be useful? And across the world, predominantly the whole world locked out. One country did not lock out, that was Sweden. And they suffered heavy damages. So locking was necessary to basically build the healthcare infrastructure. And that healthcare infrastructure was necessary so that now we can contain the virus and chase the virus. And in that is linked to a policy that you can't wait for the virus to strike you. You have to chase the virus in the community and eradicate it. And I think that is what Mumbai has shown. That is what many countries in the world, like Vietnam, like Thailand, like Indonesia, like Taiwan, like New Zealand, have shown. Chase the virus out of the community. And you need to test, trace, isolate in the public health sector and treat and care in the hospital sector or healthcare sector. That was the way to go. The last thing which I would like to say before I ask you a question, Guru Anna, is that we learned that everybody in Corona doesn't need to be in a hospital. For example, in late March or early April, if somebody got a COVID test, it was like a death sentence. It was a lot of fear, a lot of anxiety, and people went to a hospital and stayed there till 2 tests came negative. Now, we have had a complete U-turn on that. We don't need to do 2 tests. After 10 days, the virus is non-replicative. You can discharge a patient without a test, and an asymptomatic patient need not be admitted at all. So this is the big U-turn, V-turn, which we took as the pandemic went out. But Dr. Harish Shetty, I have a question for you. That in these 6 months, from a mental health perspective, there has been a chaos. From coro anxiety to coro fear to coro psychosis, and now it is getting people are really going to need a lot of resilience. So, what are your experience in the last 6 months from a mental health standpoint? Because the battle is as much mental or more mental than actually physical. The virus in the body can be mitigated, but a virus in the mind is impossible to mitigate. Even today, I get people who think they have corona, they don't have corona. They have corona, they don't have corona. Their test is negative, still they feel there is virus inside their body because they are symptomatic or pre-symptomatic. How do you handle this mindset of people? And what are your learnings in the last 6 months, sir?
So, my dear viewers, you saw that we are going to ask questions to each other. He's going to ask me about mind, I'm going to ask him about his body. And just to add what he said, the American Medical Association also conducted a study in one of the hospitals in the United States of America, and they found that mask brought down the number of infections upon hospital staff in one of the hospitals, I forget the name. Across the last 6 months, we have gone through a lot of U-turns and V-turns and a lot of turmoil ourselves. When we began, after every disaster, Shashank, there is an impact phase of a disaster. Earthquake ala, zala. Cyclone aya, ho gaya, finished. But here the impact phase is lasting for the last 6 months. The pandemic impact is lasting for the last 6 months. In the post-impact phase, what happens in every disaster happened to us. We were in the honeymoon phase and we were locked in a room. आगे भी जाना है मुश्किल पीछे भी आना है मुश्किल. So we were locked in a room, and we were all very happy to be with the family. We were posting hundreds of things, a lot of things, and in this entire environment, there was some amount of joy for a large section of people, but for the poor it was very difficult, and it was a mixed bag. Across time, we have learned that managing fear and uncertainty are the two most important demons. I would not say demons very strongly. Fear has to be managed because fear is very, very adaptive. Fear is very, very essential. But we see now symptoms which are very different, and that is change in the tone of the voice of the person. And changing the tone of the voice of the person would mean that either the tone is irritable or very vulnerable. And the tone is very irritable and very vulnerable. There's chaos inside the house. You were not like this before. Why are you doing this? We were all safe. We're inside the house. But that question, when the family asks, is not the right thing to say. At a time when the person is in a mood to talk or mood to listen, put your arms around the boy, the girl, the man, the woman, say, yeah, so much irritability. And then what spills out, if you're able to elicit this without the help of a psychologist, is that I'm very scared. I don't know what will happen to all of us, and I'm very scared. And one that spills out, and when there's a lot of assurance, the tone improves. The second tone, that leza, as I call leza, ultimately it's all about tone now. It's tone. Because we are going to maintain a distance, we're going to connect only with the tone, not with the eyes or the face or the nose or the cheek. The tone is very important. The second tone is vulnerable, tearful. And sometimes men have been found to be crying inside the house. And when men cry, everybody gets scared. When the women cry, people do not get scared because people say there is resilience, he's going to come back and things will be much better, which is also not right. And when these men break down and start having a voice which is tearful, very tearful, the entire family goes into chaos. But don't get panic. Don't panic at all. What you need to do at that point of time is to put your arms around the man if you have not put your arms around the man for a long time. Then say, "Bhai, kya ho raha hai? Dar lagta hai yaar." And this little dar can be managed inside the house, and that I think is very important. So tone. The second symptom we see across time now. Earlier we saw panic attack. Earlier we saw joy. Phase of altruism. Now in the immediate post-impact phase, what we see now is that restlessness is what we see. Restlessness, which means there's some amount of physical restlessness inside the family. The man is going, no, I have to go and buy this. Then he says, I have to go and buy this. This physical restlessness is also a sign of early agitation. If not managed now, it can lead to more anxiety and probably depression. What is depression largely? I fight the stress, and I give up, and that's depression. So again here, the same principle. यार, don't panic when you ask. तुम ऐसे क्यों करते हो? Put your arm around and say, यार तुम ठीक हो ना? And if the man shares that मुझे भी बहुत डर लगता है, it's a very normal thing. Now things are much better. The third thing which is important, fear also causes hoarding, no? Shashank, we see it all the time. People are hoarding masks, people are hoarding food, people are now hoarding even medicines. And in Delhi, they're hoarding plasma. So fear also can lead to hoarding. And again, in this post-impact phase, there is something known as pandemic fatigue. People are asking me, यार इतना दिन बैठा कुछ पता नहीं क्या हो रहा है, but something is happening. It's not depression. यार कुछ 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 करने की इच्छा ही नहीं होता है. When you rate them, they don't fall into the depressive category. Let me tell you three things now to Sir's question. Number one is rewiring about three gods. No, not Brahma, Vishnu, and Mahesh. Not Brahma, Vishnu, and Mahesh. Mask, hygiene, and distance. Three gods, three new gods on the earth. Mask, hygiene, and distance. It has to wide again and again because we drop our guard. We feel everything is over. So that wiring is number one what we have learned across time, and that has to go on for a very long time. That is one. And the second most important thing is that that when you are in your house and you feel very listless, only one thing can break it, and the only one thing can break it. And the best way is whether you have done exercise, never done exercise in your life, start doing exercise at home, do physical activity to beat the pandemic fatigue. There are other things also which psychologists will explain, art therapy and drawing, coloring, etc. etc. But physical activity will change the neurochemistry of the brain and will allow your cells to talk to each other. So three gods, rewire repeatedly, exercise, and go behind the tone which is unfriendly or very vulnerable.
So tone is important, exercise is important, building the mental resilience is important, is what Guru Anna said. Dr. Kaundinya, who's a microbiologist, always asks questions and he's always on our show. He was our teacher at Grand Medical College. He's saying that we have a lot of mindfulness and spirituality, and he calls it as spiritual augmented cognitive behavioral therapy. And that is much more impactful than rational emotive therapy. So, why don't you recognize the contribution of spirituality, which was an Indian way of life for RET or CBT? And, he is giving example of Raj Yoga. So, Dr. Shetty, we have Vipassana. So, how can we integrate in these difficult times, yoga, meditation, pranayama, as well as some of these Raj Yogic techniques as a part of a behavioral change and CBT. Because to change tone, you need to change your attitude and behavior. And then you have to go through a program, CBT program. So, do we have tips from our ancestors? Because, Dr. Shetty, is not only a psychiatrist, but he has done a diploma of comparative mythology from Mumbai University. Many of you all may not know, but he is the true mythologist. So, can you have a mythological connect from our Indian systems which have evolved over centuries? Is there a way to connect that with CBT, mindfulness, Vipassana, and calming down? So it's all about calming down to maintain your cool. And if you are able to maintain your cool, then you will have common sense. And I think the two buzzwords in this pandemic is be calm and use common sense. Dr. Shetty.
Absolutely. Before I ask you on the second question, let's answer this, Dr. Shashank. Uh, God is the champion of diversity. There are multiple roads to God. Similarly, there are multiple roads to health and good health. Vipassana is one of them. So you have a range of roads. Even Ramdas Swami also wrote a lot about CBT in his Das Bodh. So anybody can choose any road to calm themselves. For example, I have a friend, a Jain friend, who was very tense and anxious. He went to a psychologist, it didn't help. But when he spoke to his Guru Maharaj, he calmed down because his regard for that Guru Maharaj was very high, and the Guru Maharaj had an effect on him. So there's nothing wrong. But what is also very important to understand that people who practice one form of meditation are too loyal, fanatically loyal to that form of meditation. That loyalty can harm because you might find joy by having lime juice, but somebody might find joy by having orange juice. So let him have his orange juice, let me have lime juice. But I completely agree with you, Dr. Shashank, that mindfulness and all other activities, if we are exposed to, and somebody picks up one and is helped, we need to actually go and do it. But loyalty and fanatism for one form of therapy is extremely bad. I do well with Vipassana. In my family, they do yoga and they feel extremely good about yoga. So it's perfectly all right. Shashank, I need to ask you this. Across the last 6 months, you have been in touch with intensivists across time. You have been in touch with doctors, patients. You are doing home quarantine for a lot of people online. What are the pearls of learning with respect to treatment guidelines as of now. Because you know what, Shashank, I see every physician, every intensivist, every chest physician really using different lines of treatment and they may not agree with each other. It may also be because individuals are different. It's not the fault of the doctor. Individuals may respond differently. And also because the virus is very novel and we don't know much. So, a pulse of wisdom from 6 months of experience with respect to treatment guidelines.
So I think treatment of corona has evolved because this is a simple, small, particulate RNA virus. So in the beginning, we didn't have much. We only had hydroxychloroquine, hydroxychloroquine, hydroxychloroquine. That was the buzzword. And as things evolved, we learned a lot. So let us first talk about hydroxychloroquine and its role in COVID. Hydroxychloroquine is very useful if you take it once a week for close contacts of people who have COVID or for healthcare professionals. And there is data to suggest that for pre-exposure, not post-exposure, for pre-exposure, that means somebody has not got corona, you are a nurse, you are a doctor, and you are taking care of COVID patients. There, if you take prophylaxis, it works. And probably the only caveat to that is you should do an ECG and you should not have a prolonged QT interval and you can take 400 milligram once a week. There it works. In mild cases, probably nothing works. 5 days of hydroxychloroquine with azithromycin with zinc was the original treatment plan. That got fast replaced by a Bangladeshi protocol of doxycycline 100 milligram twice a day with ivermectin 12 milligram daily for 5 days, which we are still using in the research protocol, but it's not a validated. This was in the era when there was no antiviral option. So what happened then is that in Japan, in Russia, in China, there is an antiviral drug called favipiravir, which is used 9 tablets in the morning and night, 200 milligrams on day one, and then 4 tablets morning and night for 13 days. And that cleared the virus within 7 days. And that was launched by the Drug Control Journal of India. And that drug can be used in the early phase. So somebody is home quarantined, somebody is a high risk case, somebody is in the early disease, in the viremic phase. We have an antiviral drug now called favipiravir, which is available. You need to sleep for 8 hours. You need to eat on time. You need to monitor your fever. If your fever needs to be given some treatment, we need to monitor that. We also recognize that COVID is not only about those three symptoms, which is shortness of breath, which is fever, and which is basically dry cough. It could be change of taste and smell, change of inability to grip your hand properly. It is all about a severe pain in the legs. It is all about severe, just a mild headache, backache, and so on and so forth. So, early phase of corona was about antivirals, and you know the virus is replicative in the first step. As the therapy evolves, you take some vitamin D, zinc, vitamin D, whatever people may write in the newspaper, there is a validity because we are Indian vegetarian population and it makes a difference. We can also take some chavanprash, we can take some ashwagandha, and that is something which we know. These are all supportive therapies. If you get moderate COVID or severe COVID, then you are starting to get breathlessness. So you do a saturation, do a 6 minute walk test. If your desaturation is more than 3% or your saturation is less than 92%, then you are supposed to start that patient into an institution where you can get oxygen through the nasal route. Start probably a small dose of steroids. Usually recommendation is 40 milligram methylprednisolone twice a day for 3 to 5 days. Use low dose steroids or use dexamethasone 6 milligrams. That is the correct dose to be used. That is evidence based. And if still the oxygen requirement keeps on jumping and it crosses more than 8 or 10 liters, then we give the monoclonal antibodies like itolizumab or tocilizumab, which are in short supply, to clear up the lung storm called cytokine storm. But at is that stage, when the person is in a hospital, between 5th to 7th day, we also have an injectable antiviral called remdesivir. Remdesivir is not a magic pill. Again, don't get panicky if you don't get remdesivir. Okay, it is 100 milligram, 2 doses on day one and then for another 4 days. So 5 days injection you need. It improves recovery time. It doesn't save lives, it improves recovery time. And of course, then it is oxygen, oxygen, and oxygen. So remember, corona therapy has antivirals. It has immunological agents like simple Sundar Sasta Majboot steroids or monoclonal antibodies like itolizumab or tocilizumab, and then of course it has the so-called remdesivir, and there are two other therapies which I want to tell you. One is that it's a thromboinflammatory disorder. So what happens? The thrombosis can occur, and there can be clots, microclots. So we normally give low molecular heparin based on a test called D-dimer test. So there is a role for antiplatelet agents and D-dimer and the low molecular heparin clearly emerged in the corona care today. So the therapy protocols must include all these conditions. So what do they include? They need to include antivirals. They need to include immunologics, including steroids and monoclonal antibodies. They need to include this thing. And the most important thing is you can also sometimes use on compassionate grounds plasma therapy. Plasma therapy is again not a panacea. It is not to be used. So neither remdesivir nor the monoclonal antibodies nor the plasma therapy, they can have a life-saving potential, but in only expert care in severe cases and most deserving cases. Everybody doesn't need them. In fact, 85 to 90% of people are not going to need them. They are just going to need supportive care, supportive care, supportive care. Corona care is all about supportive care. And it is
Thank you.
about...
Shashank. Yeah.
So all treatment protocols, whatever may be the confusion, it is antivirals initially, immunologicals and steroids later, a little bit of plasma, a little bit of heparin or antiplatelet agents, and anticoagulants. That is the overall degree of care with a lot of oxygen, nasal route, prone position, awake prone position, nasal ventilation, and mechanical ventilator. That is corona care for you today.
Quickly, Shashank, I would like to ask you one more question. The CDC from United States said to successfully infect a patient, the virus needs a dose of 1,000 viral particles. What is it?
See, if you ask me very honestly, we don't have good data to really say what even CDC is saying is absolutely correct or not. What we need to know is what when we get a viral load report, we are trying now to push the ICMR to give us a CT report, the cyclic threshold time. If your cycle threshold is say 39, 40 or 38, 36, it means the viral load is less. If your cycle threshold time is 20, it means the viral load is more. So that will determine the infectivity of the human being. So the number of viral particle exposure, what we see in experimental situations, in human situations, it doesn't happen. For example, if I sneeze, I am actually pumping out 1,000,000 particles. Or if I cough, I am pumping out 1,000,000 particles. And those micro droplets are going to infect. So all this was talked by CDC in the era before the airborne microdroplet hypothesis was proven. So this is again outdated, and I would recommend that any droplet or microdroplet or the ventilated environment is important. Most important thing, just like the old TB days, you need open air, recirculated air, and we need to recycle and recirculate the air, and that is probably, and we need to breathe. It is the alveoli, the air sacs, where the corona is going to reside, and that is suffocating that. That is why we need oxygen. That is corona. We please need to understand why are we using saturation. We are using saturation to pick up whether you are getting you are getting suffocated. Your air sac inside your lung, which is called as alveoli, is it getting suffocated? And that is why we are looking and emphasizing on oxygen, oxygen, oxygen. So remember, Dr. Shetty, the viral particles matter. 100,000, 2,000, 20,000 viral particles matter. Those doses are relevant when we look at fomite transmission. Those are important. But if you generate an aerosol, it is not just the viral particle. Where is the aerosol generated? What is the environment? Is it humid or is it dry? Is it closed door or open air? All these factors matter when the transmission occurs.
So you're saying something to me.
Dr. Shetty, I had a question for you. That we are into this uncertainty and fear. And you know what is killing people now is not the virus. Because, we have 8 billion people on planet Earth today. And, the amount of people who do not have the virus is far more. It is maybe not even 1% of the world population is actually got the virus. But what is killing the rest of the world, which is more than 99% of the world, is the uncertainty and fear. And you need to tell us, Dr. Shetty, Guru Anna, how do we conquer uncertainty? Something which is predictably unpredictable, something which is uncertain. generates a lot of anxiety and fear. And therefore, it is important for you to tell us how do you remove the scare. I can just see Nagaraj Rao asking a question. How people are so scared about COVID, and how do you de-scare them? How do you, allay their anxiety? How do you make them handle uncertainty better?
There are multiple ways. People who are extremely anxious and who have an anxious temperament, they need different interventions. People who are extremely anxious temperaments need to do a lot of relaxation activity across time. They need to connect with people who are positive. Otherwise, as Nagaraj said, they can infect others with anxiety. See, anxiety travels faster than the coronavirus. That is number one. Number two, a lot of distractions can break fear, and that I think is very, very important. People are doing this. People are not in denial. There is virus, there's a thought, but they're doing a lot of other activities which really gives them joy. A lot of humor inside the house can bring down fears. Number four is realistic appraisal of the situation. I said that in the last tequila shot of science, though it might appear to be a joke for somebody, but it's very important for us to communicate in the manner that is important. The shot of science is, I said, these three gods has to be recycled again and again. The fifth thing is spiritual approach towards life. And what is your meaning in life? Your meaning in life is you want to survive, you want your family to survive, you want your community to survive, and you want the world to survive. So if we are supported and really connected with the larger world around us, and you talk to people who are in the same state, they can bring down the anxiety of others. Though yoga, meditation, vipassana, other things are very, very useful and extremely useful. When you talk to somebody who has come out of corona, he or she can give you more hope than anybody else on the earth. And speaking to somebody who has really come out and said that I was there, I was giving option, so I'm perfectly all right. Looking at the big picture in terms of uncertainty, World War II, schools and colleges were closed. There were no jobs. Partition of the country, 47, people came with nothing, and there's absolute uncertainty when people settled in Sindh, people settled in Gandhidham and other places. Pick up such stories of resilience around us. Small stories. Don't pick up great stories. When you pick up Winston Churchill and Mahatma Gandhi, you feel you can't be them. So pick up small stories of resilience around you, and that will also give you hope. Because hope brings down phobia. Remember, hope brings down phobia. So arousal of hope through different means. There are people in the family who are really providing hope to so many others. Be with them. And at the same time, tickle your limbic system to provide hope for others. One important thing which I feel people have been using for improving their own resilience. In spite of you being anxious, when you give realistic hope to others, your anxiety goes down. Say, for example, when somebody calls up, यार मुझे बहुत लगता है डर, मैं तो ऑफिस बिल्कुल नहीं जाऊंगा, and you don't have to echo, मुझे भी वही होता है. It's good to echo, because when two negatives meet, there's a positive. Minus into minus is plus. Very important to understand. And also, but you should, apart from saying मुझे भी लगता है डर, यार कुछ नहीं, we will both come back out of it. So minus into minus is plus, and plus into plus is also plus. So these are the small things, but very important is pray to God also to give you courage and hope, and not to drive the virus. And if things go out of hand, and as Nagaraj said, that you're extremely panicky, meet the friendly neighborhood psychologist or the psychiatrist. That I think is very, very important.
So thank you, Dr. Shetty. So Dr. Shetty, you have all the time. Yeah, go ahead.
Yeah. So, you know what? We have been hearing of the cytokine storm, the lung storm. And now we have a lot of evidences. I do not know much, but I'm a layman as far as all this is concerned. That there's a lot of fear that's affecting other organs, and people are talking about post-COVID infections. I met a lot of post-COVID client patients, and many of them have got anxiety, which is continuous, which are managing. But many of them talk about extreme weakness. Young boys are talking about extreme weakness. पता नहीं ये weakness कुछ अलग ही है. I've had flu in the past, but ऐसा weakness नहीं है. Is it physical? Is it mental? So I would want to ask you, sir, what is it that happens to the other parts of the body? What happens at the time of recovery, and how should people recover much faster?
So three things. One is that let me talk about cytokine storm or cytokine release syndrome. This is a very serious syndrome, and usually it happens in moderate to severe COVID. There is a lung storm. Somebody had put out a case that IL-6 was 1500, the LDH and all other parameters are normal. And I would urge that person, 10 days there are symptoms, fever coming off and on. do a HRCT scan. If the HRCT scan is negative, then probably you are good. But what happens in cytokine storm is all the bad chemicals come up, and they can not only damage the lungs, they can damage the lungs, the heart, the pancreas, and the kidney. And these are the organs where they get damaged. Usually, these are hospitalized critical situations under doctor supervision. So, cytokine storm, you leave it to the doctors to handle. And we have very good drugs, whether it is steroids, which you give early, whether it is a lot of oxygen through a nasal route, or whether it is these monoclonal antibodies, whether it is itolizumab or tocilizumab, which are very easy to use, you can clear the storm. But the second part of your question, Guru Anna, which you asked, is that there is a lot of post-recovery tiredness, fatigue, because what happens is when you have killed the virus, the remnant dead virus and the negative chemicals stay in our body, and they sometimes take along 2, 3, 4, 5 weeks to go. Sometimes a little bit of fever also may stay. I've had patients who have had fever up to 40 days. So remember that it is very important to recognize that the fatigue, the tiredness is out of proportion to a normal flu. This is not a normal flu. It's a tricky, smart flu. Normal flu with treatment, 7 days, without treatment, 1 week, which means it's the same. While this flu or this common cold virus is a very sinister virus, and for the first 10 days, it is replicating, it is infecting others. But after that, the telltale effects are lasted. If you had a change of taste and smell, usually you recover well. Some people have severe fatigue and some amount of sickness, which may last even as long as 30 to 40 days. Most people will recover in 2 to 3 weeks, and by around a month, you are back to normal. If you still don't do that, you need two things. One is you need to see a friendly neighborhood psychiatrist and counselor, and you also need to see your doctor. Do not give up your doctor at all. Keep in touch with your physician, whether it is a general practitioner or your physician, 24/7, so that you can get the right treatment. Also, you need to get your comorbidities under control. People who get the cytokine storm most of them are either a diabetic or a hypertensive, or they have chronic kidney disease, chronic lung disease. So people who have those vulnerable conditions, they are the ones who get it. And from there, I'm going to ask Dr. Guru Anna the conditions. Vulnerable groups cause more cytokine storm, like hypertension, diabetes, kidney disease, liver disease, COPD, and so on and so forth. But in the family, there are vulnerable groups, Guru Anna, like senior citizens, like children. How are they coping up? What are the measures, Anna, which you will tell for this vulnerable population? Because there is a big vulnerable population which is feeling lonely, who are alone, they don't feel up to the mark, they have this in the mind more than in the body. And also, the vulnerable group also has this fear, like a diabetic. I got a call from a diabetic day before yesterday saying, Dr. Saab, मला डायबिटीस आहे, मला कोरोना होणार आहे. कारण सगळं तुम्ही म्हणता ऑल द टाइम ऑन द टेलिव्हिजन की कोरोना इज ऑल अबाउट इन डायबिटिक्स. So how do you handle these vulnerable groups, or how do you counsel these vulnerable groups? And do you really need to give them anti-anxiety medicines, or do you need to just counsel them? Should I refer them to psychiatrist ASAP? Can I just give them some assurance? So vulnerable groups and their management has become a larger mental health problem than actually a medical problem. Kurand.
Yes. I thank you, sir, for asking the question, Dr. Shashank. In my experience and the experience of a lot of friends, I see vulnerability among children and adults who have existing financial problems, existing mental health problems. And I see that across board. I saw a young girl who had a father who was an alcoholic and a mother who was under treatment of depression, suddenly reporting suicidal thoughts. No past history in the past, and the parents have been taking care of the child beautifully and wonderfully. So I attribute this to genetic vulnerability and distress. That is number one. So I see a lot of young kids talking about death and dying, and these things. I think we cannot just look at assurance and support. Support along with psychiatric treatment and psychological care is important. The second is a lot of people who are isolated much before corona, in the sense they may live with the family, but they're isolated from the environment. They don't mix around with people. They don't have support system. Suddenly they find themselves very lonely and extremely scared, and they don't know. They don't have the social skills to really connect again with people around them. These people need some amount of assurance and counseling to reconnect to the world with whom they are disconnected. And that I think is so important. Third most vulnerable group are families who have lost people. I have a friend who lost her mother at a hospital. Her father is in ICU. Her brother is, and she are admitted in a hospital. The husband of my friend and the kids are quarantined, and there's no closure at all. I would want everybody who's listening to this conversation, if you have heard among your family and your close relatives somebody has passed away, please connect with that family. And when you connect with that family, don't ask which hospital you are admitted in, what was the treatment, what happened. You should have gone to this. Please connect and be available to them to talk, to allow them to share, and see that you are with them and they are free to talk whatever they want. They may not talk about the death, they may talk about other things, but they feel like calling you and talking to you, and you are listening to them. There's no need to judge, there's no need to inform, there's no need to advise. And if you don't understand what's happening, probably what is extremely important for you is to actually find a specialist for them if necessary. Otherwise, be the support, be the befriender, be the person. And lastly, a lot of people have lost their jobs, and we'll come to that a little later. And that's a very, very vulnerable group. Not because they've lost their jobs, they've lost their self esteem, they've lost their confidence, and that is something we'll come to a little later. Dr. Shashank, there's been this question all the time across the 24 sessions. I am a family doctor. मेरे को हिम्मत दो यार. 6 महीना हुआ है, मेरे को हिम्मत दो थोड़ा. What is it that I can't stay at home? You know what? I'm not a rich man. I have to live one day at a time. All doctors are daily wage laborers, and I need to take care of my family. I need to see that they're safe. Give me some confidence. Please give me some confidence. Can Famipir can whatever the drug is can be used by a family doctor?
So, you are asking that whether family doctors should kickstart. I have seen a lot of family doctors, either virtually or physically, have started their work back again. And I have seen them giving excellent virtual advice. In fact, most of our home quarantine patients are beautifully managed by our general practitioners. They are doubling up, not only giving medical care, but also giving psychological care, allaying the anxiety, getting some right tests done, teaching the patients how to use the 6-minute walk test with a pulse oximeter and saturation. Somebody asked the question how to use a pulse oximeter. You have to put it in the middle finger. You have to wait for some time. You have to use it in the right way. When you walk for 6 minutes and you check the saturation, if it drops by 3%, it's abnormal, or if it is less than 92%, it's abnormal. All this is taught by general practitioner. General practitioner is the core of our medical system. And I think some of them have been knocked out. Some of them might be senior citizens or in the vulnerable group. They are available to you 24/7 on the phone. And virtual consultation and telemedicine has become a norm. That is why it is important that we empower our general practitioners by more education, by giving them confidence that they can treat a lot of COVID in from a virtual space. And it is possible and it is likely to do it. I don't see that happening very often, but I think now we are seeing more and more of our general practitioners right there, and they are not only at the front line but also virtually available to our patients, doubling up or tripling up the job of a good family doctor, tackling corona at home and hospital. Also, they are the ones who are tackling corona after the patient comes back home in the recovery period. Recovery period is very difficult, Dr. Shetty. They are mentally down, they are physically down, they are drained out. I have had patients who called me this day before yesterday and said, Doctor, my every cell feels it is exhausted. It is completely drained out. I just cannot move my body and I just can't think straight. Can you give me a pill to just get my energy back? And we have to give them nutrition. We have to give them nutritional supplements. We have to tell them to be mentally positive. They are not getting sleep. They are sleepless. They need some anxiety elevation. They need to be physically active, as you said. And we need to also give them some amount of micronutrient supplements so that they kickstart their life again. So that's very, very important. And I think general practitioners play a huge role in this pandemic. So, Dr. Shetty, when you are talking about all these conditions, mind is as equal it's very important to recognize that the mind is a crucial element in recovery. And in the recovery time, I think not just before diagnosis, but in the recovery time, it is equally important to handle the mindset. I have seen two extremes. One extreme which severely goes down into a very low and they feel very depressed. And I've seen another extreme which is so positive. They think they have conquered corona, that to the point of recklessness. So how do you handle these extreme cases of severe lows and severe highs? How can you do that? And how can one handle that? You're not audible, Dr. Shetty.
Sorry. There are three responses, and one is I deny and I repress the thought, and I probably don't. I'm not aware of any corona around you, and you drop your guard, and it's very risky. Uh, the the second is all those people who talk a lot of positivity inside the house. "Jai kuch nahi hoga," they are chest thumping heroes, and chest thumping heroes is something we do not want during corona times. Rara beating of the chest which we do not want. What we need is extremely important, is a rational, and so self talk is very important at the time of corona. खुद की बोली, हम अपने आप को क्या कहते हैं, क्योंकि हम बार बार पूरे दिन we talk to ourselves all the time. So what are the things you tell yourself is the first most important thing. So tell yourself the tequila shot of science, which I've shared in the last few conversations. And the second thing, what is important, what you tell yourself is that till now I have been careful and I have been safe. Till now my family has been careful and I have been safe. And I will continue doing that for a long time, because remember the HIV epidemic, we always felt that using condom is safe, and that's what we preach. But it took a long time to wire the people who have unsafe sex to use condom. It took a very, very long time to similarly to wire a person to safety as far as COVID is concerned will take a long time. The third most important thing about the mind is keep your mind stimulated by activities all the time. I mean, do something which you love, and also understand, please listen to the thoughts which come against your will, and those thoughts that come against your will are thoughts which could say, your safety is not enough, you should do something more. See, this is happening around me. How do you filter the sentences which come around you? All those people who are, there are 130 crore corona experts in the country. So it's important to filter what you listen, what you see, and what you hear. And the last thing is the mind responds to what it loves. It's not only the mood lifters, the gloom busters. The mind responds to karuna to beat corona. And if you are able to do in your effort a little thing, even a phone call to somebody whose family has passed away, even a little thing, if you call up your doctor who's recovered from corona, your own family doctor, if you call up that old relative who feels that you have rejected him, and you pick up the call, and at this really helps you to come back normal. But a small dose of anti-anxiety drugs for somebody who's not sleeping, somebody who's very anxious, no harm at all. A small dose of SSRIs for doctors, I'm telling them in general practice or in physicians, no harm at all. A small dose of tricyclics, no harm at all. But when you give tricyclics, either in the corona ward or otherwise, understand that it should not cause any respiratory depression. And in a corona ward, you should see to it that you need to give it along with consultation with the physician. Lastly, in Corona Warriors, when I conduct sessions across different places, there are many doctors who are exhausted and tired, and they want to go home. They're outside Bombay, and they are tired and exhausted. They're not depressed. Ghar jana yaar, 7 दिन के लिए, allow them to go home if you can. Number two is there are many doctors who are tearful and are still working. Screen them for depression. I'm talking about warriors. Screen them for depression. Third is I tell the Corona warriors, keep yourself supported. Don't only talk to your friends, talk to the others whom you do not know, but they're part of the hospital team. And I would like to share a message by Dr. Vani Pulalli, who's a frontline Corona warrior and is a psychiatrist. That's a message which you all need to hear. I am a mid-career psychiatrist and have joined COVID duty at BKC. I had been already told good things, but the people who told me are very gentle, non-complaining types. So I wasn't so sure. Now that I'm here, I can clearly see that very good work is happening here. Congratulations, Dr. Joshi and MCGM. It's very safe. People get along well, arrangement for stay are outstanding, and patients are improving nicely. They train you for the work, and because of clear protocols and helpful nature of experts on team, one gets to make a contribution irrespective of subject of specialization. I'm happy to have decided to join. I will recommend this to other doctors like me. For all the nice things, there is a real shortage of doctors and the salaries are not coming on time. The first issue is to be solved by more of us is stepping in. And I think it is best to keep salary as lowest on reasons to join if you can afford to do so. Anyway, it's not my idea to live in fear and estrangement. I like to live with passion, and for that, I'm prepared for certain degrees of risk. I think this clears the mind of all fears, Dr. Joshi. When you convert pain into gain and meaning in life, I think that is something which is very beautiful. And Shashank, I would like to ask you. You have been talking to task force teams, Corona warriors, etc., and you have treated so many of them. I would not take names on your own and with the help of other physicians. What is the mental health state? I'm asking a mental health question. What is the mental health state of our Corona warriors? I'm talking about leaders and policymakers and others. And what should we be doing to really help them sustain this emergency for a long time so that they continue fighting the battle for a little longer?
So I think when you talk to Corona warriors, you need to be very cheerful and positive. You cannot lose focus on something called as fatigue. And I see that after they are a different human being pre-corona and a different human being post-corona. And I think it is the mental resilience which counts. Some people are down, but they bounce back. I have seen everybody bouncing back. And I think they bounce back with a renewed vigor, that zest, zeal, enthusiasm to fight the disease. After conquering corona, it's much more stronger and they have a stronger resolve and resilience to fight the disease. That is what I have observed through all the corona warriors and the medical and the healthcare professionals, which have taken deep active interest in their day-to-day management. Dr. Shetty, with your permission, one of the reasons we too decided to do this show today was to take a lot of questions. So I am going to scroll down in the next 3 to 5 minutes and rapid fire answer a lot of what small questions which have come in. Is
I
that
think that's
okay?
a good idea. Fantastic, fantastic.
So I'm quickly going to scroll and I'm going to rapid fire now. There is no one size fits all in Corona. So a lot of people have a lot of questions. For example, this neutrophil lymphocyte ratio, it works. It's an easy test. It is cheap. If you do a CBC and you get a neutrophil lymphocyte ratio which is adverse, it clearly works. Then the vaccine I will answer later. What are the predictions about Corona? Can we celebrate COVID with Diwali and Navratri? Yes, with masking you will be able to celebrate it. Do you have cerebral thrombosis? Have comorbidities? Can it cause thrombosis? Yes, it can. That's why take antiplatelet agent like a simple aspirin and statin is good enough. For people with travel history, can we do an RT-PCR test? Is it mandatory without going through 14-day quarantine? No. I think every state has its own restrictions and you need to do that quick and fast. But I think 7-day and 14-day quarantine have been mandated to save the lives of other people so that there is no transmission of the disease. Then, people have asked me questions about fenofibrate. Fenofibrate is a research mode. It's a good option being considered, but currently it is not standard of care. People have asked me, can you use Deflacort? Deflacort is another steroid. Standard of care steroid is 6 milligram dexamethasone. That is standard of care. Any equivalent dose of that, you can do that. How do you tackle carriers? Carriers are spreaders. They have asymptomatic disease. They need to do strict masking to self-protect me, but also protect others. So that's very, very important to recognize that carriers are very, very important to distance that very clearly. Then, lot of people have asked me questions about doing the HRCT and the antibody testing. HRCT is a very good tool under medical supervision. If in doubt, do it. You will get ground glass appearance. And then antibody testing. Antibody testing tells us whether you are protected or not. If you do an IgG test, it has two uses. One, it will tell you whether you are eligible to donate plasma. And second, it will tell you that whether you have any immune protection. What can the virus be transmitted through vegetables and groceries? Well, you need to clean the vegetables and groceries 3 times with water and some potassium permanganate and it is good enough. Okay. Now my questions to Dr. Shetty, and I think I want you to answer some of these questions. There are two major questions I've seen which have come up, and then I'll take probably a vaccine question after you come back. One is that how do children, particularly who are mentally challenged, how can parents handle them? And equally important question is adolescent children. I think parents now are finding it very tough to handle these two group of children, and I think it's important that you address that. Secondly, Dr. Kaundini has again asked that you need to address the question of this mental hardness which you are talking about. How can it be done for population in general as well as healthcare professionals in general? And the last question before I ask Dr. Shetty this is one of our doctors had severe asthenia. Severe fatigue is very common in the recovery period and can last up to 2 months. But you need to be focused and strong, and you need to keep eating on time and sleeping on time. I think eat slowly, eat on time, have proteins, have some vitamins, ensure that you have 2 hours of digital free time so there is no screen, no television, listen to some music, do some yoga, and 8 hours of sleep. All these things, if you do with a lot of smile, with a lot of positivity, your recovery will be faster compared to that you feel tired and drained out all the time. Dr. Shetty.
A last question first. I had a patient who had recovered 3 months ago, the first round of corona, and he continued feeling asthenic for a very long time, tiredness and exhaustion. And every physician gave a lot of multiple medications, vitamins, etc., etc. Some gave them even modafinil that did not work. But what actually worked, and I'm surprised to say this, Dr. Shashank, was an SSRI, because I found that extended exhaustion and tiredness could be a sign of depression. Now, I do not know if SSRIs work as an antidepressant, because fluoxetine is also studied, is being studied as an anticoagulator. So very important to differentiate exhaustion, asthenia, and mood changes, which can happen as a consequence of the infection. That's number one. Number two, very important, is I feel very humbled and helpless when it comes to children with disabilities. I want you, Dr. Shashank, to revise your protocol for children with disabilities. And I want you to do one thing. Let buildings allow children with autism and other disabilities to go around with protection completely, along with one escort, so that they have some stimulation and some movement and some activity. Otherwise, they're getting extremely aggressive in the house, and any amount of medications can't calm them, because it's not right to give, right to replace medications for a social reason. That is number one. Number two, I would want a new protocol. If schools have to start, let the special schools start first, and they be supervised by the local ward officer, that the safety and the distance is maintained, the masking is maintained, so that these special kids get some activity and schooling earlier, because they are the most vulnerable and they find it very difficult to live. So we need to work on these two protocols. So I have seen a lot of special kids. I have a lot of parents who SMS me all the time, and I feel helpless because they can't move out. They can't go and meet anybody, and they can't go to school. And in the building, out of, so somebody said there's a lot of mistrust. There is Pathan secretary, Pathan president, who does not understand what a special child is. Adolescents. What is very important to understand is that adolescents are getting frustrated because they've passed their exams, they can't go to the college, they pass their exams, and some of them can't go to colleges where they have got admissions abroad and in parts of India. एक बात उनको समझाओ, युद्ध भूमि में, in a war zone, we need to sit in the bunker for a longer time. And we don't sit in the bunker to hide from life, but we're sitting in the bunker because we are hiding from the virus. 1 year of sabbatical, gap year. If we lose 1 year without a job, if you lose 1 year without an admission, if you stay and do not go to the college of your choice because it's a hotspot, nothing goes wrong. Use that time to gain skills, many skills across them, because you are born in an era where there is online learning. I was born in an era where I had no phone. It took me a long time to get a Kalapila phone on my house. So use it completely. Build your skills across time for other things of life. And one of the most important skills you need to learn is interpersonal relationships, managing people, and managing the environment. Also, adolescents, I feel, are calmer, and those adolescents who are calmer are those who do household work, therefore they become grounded. And the second type of activity which adolescents can really calm, the most rowdiest child becomes calm when he does some seva during Corona era. Now parents are scared. काय का सेवा बच्चे को हम किधर नहीं भेजेंगे? Don't send him anywhere. Kids are very smart in doing a lot of online work and getting help from others for others. And the joy of feeling good about doing something to others is extremely important. Lastly, don't overestimate or don't blame every adolescent behavior, every abnormal behavior of an adolescent as adolescence. As adolescents. No, if there's a behavior which does not change because of any attempts you have made across time, remember 1 year ago, if you had fever, you would take crocin, stay at home, stay for some time. After 3 days, you might go test for dengue if it's monsoon, and then you might go test for malaria, and then you'll manage it. Today, for one episode of fever, you run to clear your thought about whether you're COVID or not because it's necessary. Similarly, my dear friends, my dear parents, if there's change in behavior which remains for some time, not more than 1 week or 2 weeks, what is very important is that you need to see a psychiatrist screen to do mental health screening. I think that is what is very important. I hope that I've answered all the questions, Dr. Joshi. So let me hear from you about what type of mask and is the vaccine in the horizon?
So, two, three things about mask. Number one is, as we understand better, if you are going to use a mask, even for lay people, you might need to use an N95 like mask. Now, I know that this has been a big flip flop and many people will get confused. But if you are going to go into a closed, ventilated space or you are not able to distance, it is better to use an N95 mask. The guidance on this will change in times to come. So, that is the first thing. Second is, every day I'm asked a question about vaccine. So vaccine will come. We have two types of vaccines. Vaccines which are already available, which we use in day to day, right from Dr. Nilima Vaidya to many others have asked, can we give a flu shot? Can we give a pneumococcal vaccine? Can we give BCG? Can we give MMR? And the answer to that is absolutely no. They are in research mode. You can try BCG, it will boost immunity. There are research trials going in healthcare workers where we are giving BCG to boost immunity, and BCG vaccine might be useful. But can I give it to everybody? The answer is no, but research trial is going on. Can I give MMR? Again, research trial. Currently, the answer is no. Can I give oral polio vaccine? The answer is no. Because many of our children have already got these vaccines. A second booster might boost our innate immunity, and that is a research question. What about the two corona vaccines? Which are the countries which have corona vaccines? Let me quickly do a 1 minute summary on corona vaccines. The country which has already got a corona vaccine is China and Russia. Both of them have finished their trials. Chinese military has a vaccine which is available for their use, but I think it is going to be restricted in China. Russia apparently has finished their phase 3 trial. The earliest and the closest vaccine which is coming out, which will pimp the loop, is the Oxford vaccine. By October, it should be available. India has two candidates, one supported by ICMR with Bharat Biotech and other supported by DBT from Zydus. One from Hyderabad, one from Ahmedabad. Both the vaccines are now being inoculated for the phase 1 human trials. So animal trials, they have shown excellent results. The Hyderabad Bharat Biotech ICMR vaccine is a live attenuated vaccine, while the other vaccine, which is the Zydus vaccine, is a DNA vaccine. So they probably, let's hope and pray, with the next 3 to 6 months, we see the light of those vaccines for India. In the United States, there is another vaccine made by Moderna. Its phase 1 trial was just published last week in New England Journal of Medicine. It appears attractive for the American population, may not be useful for Indian population. The last question is, should I give a pneumococcal vaccine or a flu vaccine? Do not give flu vaccine of this area. The flu vaccine now will come in August, September for general flu. That you can give for general flu to protect from general flu. If you are above 65, 55, you want to give a pneumococcal vaccine, you can give it to protect from pneumonia, but that is not for corona. So we cannot use these vaccines for prophylaxis. Dr. Virendra Goyal is asking, can we use BCG and MMR? They are in research mode. Currently, we don't recommend them. Okay, but healthcare workers have tried them out. So immunity building is an order of the day, and we need to take care of immunity. We have a lot of immune adjuvants, and we need to do that. Dr. Deepa Rajgopal is saying a lot of patients are losing weight of 8 to 10 kilograms. How will the patient get back their kilograms? Give them supplements. There are excellent supplements available now. There are supplements which are oral nutritional supplements like say Ensure, like Resource, and many others you can take and you can build up your body. You can eat well. You can eat well. And that's something important. Lot of people have questions about vegetables and cooked food and whether the cooking is going to destroy the virus. Remember, if you clean the vegetable and fruits properly and dip them in water, clean them well with soap and water or with a lot of these veggie cleans which are available now, it will be virus free. It is not a foodborne disease. Let me tell you again and again, it is not a foodborne disease. A lot of people are asking me a question, what about maids and drivers? You can do antibody test on them. You can do an antigen test on them. You can do a SARS-CoV-2 test on them. If the antibody is positive, that person has already suffered the disease and that person is fit to come back home. So that's something which you need to assure, but still be careful. Still be careful. Have very good hygienic practices. Hygiene quotient is as important as the immunity quotient. So two questions which I have answered. One is, can we build immunity? The best immunity and the best immunity is have a very strong, resilient mind. That will give you the best chemical generated from a hypothalamus. Second, eat the right proteins at the right time. Sleep well. This is all important for general immunity boosting. And then you might have a vaccine which is coming up very soon. Whether it is a MMR BCG or whether it is a Zydus or a Bharat Biotech vaccine or whether it is an imported vaccine from Russia we'll get, we don't know. But 3 to 6 months we will have a vaccine for sure. But till that time, the vaccine is a social vaccine, social vaccine, social vaccine. It is masking and masking and masking. That is the order of the day. And you can eat, but stay clean. Hygiene, hygiene, hygiene is important. All you need is water and soap. You don't need specialized chemicals. You don't need to go to a shop to buy something which is unusual and inappropriate. All you need to do is keep it clean, clean, and clean. Diarrhea is a symptom of COVID. We are seeing unusual symptoms of diarrhea, and you know that we can handle diarrhea appropriately, and diarrhea can be treated. People who are diarrhea, there the toilet care is very important, and using separate toilets is very important. Toilet is a COVID zone, and whether it is workplace or hospital space or public space, toilets are high risk spaces for transmission of the virus. Most people who lose taste and smell do well, they recover from corona well. Dr. Shetty, I have a question for you. See, in all this, okay, our other vulnerable group like children are our senior citizens. And they feel, very sad many a times. And they feel that, they have finished their innings of life. How do you motivate? And they are all being sort of victimized at home. They have been contained at home. Nobody wants them to go anywhere. And they feel very anxious. So I got a call from an 89-year-old lady who was very active. Every day morning getting up at 4 o'clock, 6:30 she used to be out for a walk, and she's very perfect. In such individuals, in such individuals, how do you handle the mental resilience? Because now she has been shouted on, put down, she's been told, don't do this, don't go that. So she's getting fed up to the extent that she's getting depressed. And I've referred her to a psychiatrist. I have even given your number and told that she doesn't want to live anymore now. She's fed up because her day-to-day routine has been disturbed. And she doesn't want, she has lived a very self-respecting life up till now. So how can she handle herself? And I think the senior citizens need to be handled with a lot of care. What are your advices for that?
I think first is anxious young guys provoke anxiety and depression in the elders. Out of love, out of love. Again, I'm saying it's out of love. So what they do is they say, did I not say that you should not go out? Can you not understand the small thing? We say it because to protect you. Direct information is sometimes traumatic to the elderly. So whenever you go to talk to your kids or your elders, especially elders, get into a mode, take deep breaths, calm yourself down, and don't give direct information all the time. Say, I'll give you an example of speaking to my own mother. When I speak to my mother, I don't first say, mask pehna hai kya? I don't first say, are you taking care? I first talk about the farms, the coconuts, the cashew, how much money she has made after selling the coconuts. Light-hearted conversation. And then she gets into a mood, and you know how long chats can happen between parents and children. So you can stimulate long, non-anxious, neutral chats. It is extremely important for them to relax. And as the chats go on, in the middle of the chat, I can always suggest, I'm sure you're wearing your mask, huh? And you have your sanitizer at home. And then subliminal messages like this are accepted. Anxious messages cause anger, sadness, and depression. Compassionate messages cause healing, elevation of mood, and perception of support. That is one way of really helping the elderly understand safety precautions. Number two is don't keep the elderly left. Let them be involved in some activities, whether it is little activities in the family or some decision making about the family. Not that you may have to agree to all the decisions. Number three, rigidity in elderly is extremely common. They have certain things which are very rigid. These vegetables have to be kept under the sun. So do not understand, do not advise the elderly, adapt to them. Adapt to them, and adapt to them would mean, which is extremely important, is accept some of their rigidity, accept some of their issues which they cannot change. I have to go to this bathroom, I cannot change. I have to sleep on my bed, I cannot change. I have to do my Lakshmi Sahasranama in the morning at 5 o'clock, and you don't say please sleep. But she has been doing Lakshmi Sahasranama at 5 o'clock for the last 40 years because she cannot change. So adapt with the elderly, adjust with the elderly, and through very creative methods see that they are relaxed and they're happy. But if the elderly talk about death and dying, take it very seriously, because remember, the elderly, when they plan to harm themselves, most of the time they're very successful. And if you have managed anxiety and if you have managed other things, if you do not know what to do, it's important that you see, let that the person sees a mental health professional at the earliest. And also to answer this question of psychosocial mistrust. Mistrust is not because we suddenly have become bad human beings. Mistrust is because virus unites, but the virus also divides. I'll tell you how it unites and how it divides. Virus really united us with our family members when it came for the first time, but virus divided us when we got hospitalized. One person getting hospitalized in hospital, other person being quarantined at some other place, and the third person being at some other place. So virus also divides. So it is so important to understand that mistrust is also because of the virus. Fear can lead to irritability, anxious, crying, depression, mistrust, and paranoia. So for some time you can excuse that person, and after some time, when the fear of the virus goes down, trust can come back to normal. Also, we are worried about jobs, and jobs loss is something which is very, very big. Uh, I see a lot of people who have lost jobs. I see a lot of people who have got cuts in the salaries. And what's happening is many people who have lost jobs are hiding inside their homes. They're hiding inside the home. They don't know whom to say, whom to talk. Hey, remember, man, when you stood first in your college, in your IIT or your IIM or your MBA, you really shouted out that I stood first. When you got a promotion, you shouted out that I got a promotion. When you bought a BMW or whatever, you shouted out. Shout out when you have lost your job. Now, the difficulty of shouting out is shame, fear, anger, and sadness. Sadness for losing, fear of what will happen, shame, what will others say, and anger because the company removed you. Well, the process of shouting out is very easy, and I'll tell you how. When you shout out, you think everybody will support you. No, no, there will be some people who will make fun of you. There'll be others who will say, "Acha hua, bahut udi marta tha." Let them be. When you ignore them, you'll find a small number of people saying, "I think I have contacts in that company. They require somebody." And when you get support across time from people, your mood is improves, which is very, very important. When your mood improves, even if you don't get a job immediately, you are floating with your head above the water. Also, see to it that you cut corners and don't live the life which you have been living earlier. No harm at all being unashamed to cut your corners. And there's one important fact about when you lose your job. Chandrakant, Chandrakant Kulkarni, rapid fire is not possible in mental health. So one method of managing your job in the family. How would you tell your kids that you have lost the job? There are two ways of telling. देखो मेरा जॉब गया अभी तेरा पिज्जा नहीं आएगा थोड़ा संभाल के रहे मैं ज्यादा खर्चा नहीं कर सकता. That is informing and instructing. That will not work. Have a meeting. I have lost my job, and this is what it is. Let us sit down and plan what we need to do. And then you'll solicit cooperation from your spouse and your relatives and your children. And let me tell you, my dear friends, your children will come up with the most practical methods of doing things after you've lost your job. So when you share, you get support. When you inform, you get rejection, anger, and isolation. Dr. Shashank,
Yeah.
uh, uh, when people take HCQ or when there's a follow-up issue with the long-term mild to moderate COVID patients, how long HCQ should be given? How long should we actually follow up? I've been asked this question, this antibody test, which you answered. But is it possible that एक बार antibody ऐसे किया and बहुत सारे antibodies है तो जिंदगी भर तुमको नहीं होगा कोरोना? What is the status of research?
So let me tell you about antibody tests. First of all, our antibody tests are neither precise nor accurate. They are a khichdi of IgM and IgG. Ideally, what we need is the IgG antibodies with a neutralizing titer. If their neutralizing titer is in the right space and you do it every month and they are positive, it means you have immunity. Immunity lasts only for a season. It's a new virus. We do not know the last word on it. Currently, the khichdi test of IgM, IgG, which we are seeing, that antibody test gives you a titer. It only tells you that you are protected today. Whether you will be protected after 1 month or 2 months, you have to serially do that antibody and see it. That is as far as the first question is concerned. Second is HCQS is a good drug to be taken every week for healthcare workers or close contacts as long as they can take it, as long as they are exposed. So exposed individuals need to take it. For treatment, it is only given for 5 days in early cases. And that has come down. In hospitalized cases, it does not work. So hydroxychloroquine, pre-exposure works. After exposure doesn't work. If you get corona, first 5 days, it works with azithromycin, with zinc, quite effectively. Hospitalized cases, it doesn't work. Lot of questions around steroids. Do not give steroids at home. Lot of questions on inhaled steroids. Inhaled steroids have a role in corona. And they clearly have a merit in corona because there is different types of corona. So Dr. Shetty, I'm going to explain everybody different types of corona. The mildest,
Anabolic steroids,
no role, no role, no role. So nose corona. Nose corona restricted to nose, lack of smell and taste. Then you have throat corona. Then you have lung corona with normal oxygen. So this nose corona, throat corona, lung corona, which is uh, with normal oxygen is usually mild and can be managed at home. But if there is lung corona which needs oxygen, then you need to go to a corona care facility. If it needs less than 4 liters per hour, you are good. Awake prone positioning, lie on your flat and monitor. If you need more than 4 liters of oxygen, you need steroid, monoclonal antibodies and watch. And then you get corona in the lungs, which is critically ill, which needs ICU, which may need mechanical ventilator. So corona is a very simple disease if you stratify it. Our idea is to contain the corona in the nose, throat, or the lungs with normal oxygen. If it moves up above that, you need medical care. You need hospitalization. You need supervision. You need a lot of oxygen, up to 15 to 20 liters, a little bit of steroids, a little bit of awake prone positioning, and some medications. That is how corona care is. And please remember, corona is possible to be managed. Now, the immunity tests are not immunity passports because we don't know how long the immunity lasts. And that answer is neutralizing antibodies with the right titers is only available at the NIV. ICMR is doing research. We will get some kits which will be available, which will be measuring the titers of the antibodies. Also remember, plasma therapy is undergoing research trial. So it is not a panacea. The earlier you use some of these therapies like monoclonal antibodies, plasma therapy, the better will be the effect. Once the person is on a lung corona or COVID in the lungs, which needs oxygen, that is where these therapies work. And the timing, the right time and the right patient is most crucial. in decision making of corona. So that is very, very important.
So, also one fact about fear causing psychosis. So, I had a patient after the infection when he was given the report, he suddenly started hitting, beating, and biting. And so we see a few patients who have psychosis after the infection. So such patients need to be accepted by the hospitals and treated. Some of them need to be injected early so that they calm down. So beyond panic, beyond anxiety, beyond depression, we see some patients who get psychosis. Now there are other group of patients who have a lot of memories because they have been hospitalized in an ICU, they have come back home, or they have been hospitalized in a ward and they have come back home, and then they have seen those images of the neighboring patient being shifted to the ICU, being surrounded by all COVID doctors, and a lot of procedures happening. Such patients who have seen such images might get intrusive memories which can cause a lot of trouble across life. These intrusive memories, a large number of them get well as time passes, but time is not always the best healer. Intrusive memories need to be addressed by helping the memories to be resolved. And some amount of mental health intervention at this point of time may be of use because we do not treat the acute stress reaction or the difficult memories, which can cause nightmares and it can also cause fear, which can also bring down concentration performance. One might have PTSD for a very long time. Dr. Shashank, have you become fatigued because of working 12 to 14 hours and supporting different people, and what is the method that you manage your fatigue and you're available and accessible when I give you a call at 11:30 and I'm available and accessible when you give me a call at 11:30? What is it that you do for yourself, and then probably I'll answer what I'm doing for myself.
So I'm not at all fatigued. I think I'm more energetic than ever before. I was fatigued. I was tired. I had my own challenges, but I think I am completely energized because I am very positive in my mindset. See, as you said, the best propeller for positivity is when you're helping others. It is auto-generating positivity, and therefore, But I have tried to see that I keep up my 8 hours of sleep, and that is keeping me going. I have tried to see that I have a digital detox, which has kept me going, and I've been very mindful and careful of my thoughts and actions. So I think if you are very focused in what you are doing, and if you are very resilient in what you are doing, you will be good. But the most important thing I feel, which is important as a human being, is that the art of compassion and happiness go hand in hand. And I think if there is a willingness to help, there is a compassion to care, and at the end of the day, you are happy with your own self. I think that is the path. And I think this is a war time. But I don't like the analogy of the word war because we are not at war. We are into, as Dr. Kaundinya, my teacher, has used a very nice word, that adversity quotient, when it goes up very, very high and it reaches a critical threshold, then you need to have a mental resilience to counter that adversity quotient. So, for me, personally and professionally, the adversity quotient is at its peak. So, when it is at its peak, you don't have a choice. You have to swim out of it smiling. And that is what has kept me going. And I'm extremely positive, extremely in a state of mind which keeps me going. And as I see difficult situations, and you have to encounter difficult circumstances, you are able to swim it out better. Because when you are helping others, it is important to recognize that we need to be very mindful of how you handle it well. And I'm just saying the same thing about you. See, often there is frustration, and I think the frustration is higher than fear. I have no fear at all. I'm fearless in many ways. But it is the frustration and helplessness. And these are the two things which hit me very hard in the early part of the pandemic. I was frustrated because people don't listen to you, whether it is right or wrong. and I was helpless because then you go into a state of a negative energy. I have decided not to feel helpless at all. Neither have I decided to feel frustrated at all. You have to take one step at a time. The baby steps make all the difference, and just keep going. If you keep going with one step at a time, you can encounter any adversity. So it is all about not emotional quotient. You don't need to have any emotions in this. You don't need any intelligence in this. Use common sense and encounter adversity with adversity quotient. So as I said, we have immunity quotient, we have hygiene quotient, we have adversity quotient, and I'm sure Dr. Shetty, you have a large role in building adversity quotient in many of us, so that we can continue functioning in a normal way with a lot of common sense. That is the only way you can keep handling and conquering this pandemic. So, what
I
are your
think that,
experiences,
yeah,
Doctor?
yeah, yeah. Thank you, Shashank. I think you really summed up beautifully. It's not a war, as uh, as an author, a famous author said, it's a health crisis, and we need to see it as a health crisis. But what is so important to understand is people try and look for meaning in life, and when the meaning is at the door, they don't see it. So I found this to be a meaning in life. I found that if I educate, if I'm in touch with a lot of people, if I'm able to help people find beds sometimes, find ICC beds sometimes, with your help and others help, if I'm able to really bring some cheer and some smile and somebody who's very anxious, somebody who's very depressed, the meaning in life is a much powerful elixir than any other thing in life. And I think for me, meaningless. But I also got a little upset and frustrated when people refuse to follow orders. But a little difference of opinion between you, because emotions are very important. But you're right in a way. But if you become too emotional and too sentimental, you lose the meaning and lose the direction, lose the purpose. So there has to be a balance between mind and feeling, because emotions spur the thoughts also to do great things. So emotions can pull you down also, and to do things which are wrong. But I agree with you that though you're saying that you're using intelligence, but I'll tell you, your driving force is also your emotions, which you probably refuse to give enough congratulations to. So meaning in life is one. Number two is diet, sleep, and exercise. And exercise I've not been able to for the last 3 years, but I'm going to start again today. And having a meal in the family together is also a very powerful thing. Meaning of, and also trying to be very curious to know how is it that we can do much better one day at a time with the corona. Is also helping me, and at the same time, talking to my mother is also a very nice way of helping myself get better and talking to my family. Uh, Shashank, as we close, we are 6 months in the disaster. I'm not going to ask you for any predictions the way we used to talk earlier. And there's an IIT professor who came up with some mathematical thing, but I do not know if and he used a response. I used an equation, but equations are generally useful when there is something which is predictable, as somebody said. But the virus is unpredictable, so we'll not ask you any predictions. But let me tell you one thing, or let me ask you one thing. Is India prepared infrastructurally, political will, and people support as of now in the war of corona?
You're asking me a question like a press reporter or a politician, and I'll give you very frank, transparent answers. I think politically we are prepared because we have a prime minister and a chief minister, which is very, and all chief ministers, not just our Maharashtra chief minister, they are very clearly focused. There is a political will. So, no question asked. Are the people ready? And my answer to that is people are partly ready, not totally ready. People are still, we are argumentative Indians. So, we are still not willing to participate this as a movement. Until India doesn't wake up and willfully participate in total masking, total distancing, total hygiene, we will just not get anywhere with Corona. And I think we have to self protect. Atmanirbhar. We are not self protecting at all. There is a large populace in India which is reckless and which is mindless. So I think we still have a long way to go, and we need our political will to drive our people's will. That's their job. That's not our job. But we can only appeal as healthcare professionals. Are we prepared from a healthcare infrastructure? Mumbai and Delhi, yes, but the surroundings of Mumbai and Delhi may not be so much. Is rural India ready for it? Absolutely no. But can rural India survive it? Absolutely yes. Because rural India doesn't need to encounter COVID at all because they are into open space, not polluted, free environment, free air, plowing their fields. I think the agrarian farmer of India is actually the most happy person today because he doesn't have to have the corona fear. He doesn't live in a crowded place. He lives nicely. He can see the sunlight. He can see the moonlight, and he can enjoy the rains and get wet in them. And he really is the most happy person today. So if you ask me, the poorest poor who are living in rural India are probably the happiest. The urban poor who are living in crowded jungles are equally distressed. But can I tell you one thing? Somebody living in an urban slum, in a jhopadpatti, and somebody living in a vertical skyscraper, there, from an aerodynamic standpoint, both are the same. A skyscraper is another urban slum only, if you ask me. Because from a corona standpoint, corona is not going to distinguish if the virus goes into the one particle goes into that whole building, the air ventilation will circulate it to the whole building, and the whole building will be corona. So you have seen that some of the top, most plush, so-called affluent suburbs of India have buildings to buildings who have got full of corona. So coronavirus is here to stay. We have to live with corona, but I think we need to be very mindful of handling it. I think India is prepared. Politically, it is clearly prepared. People wise, we still need to keep motivating every one of us to stay calm, stay cool, and be resilient. Because I think, the time people get impatient. You see, even now, it's 1 hour 34 minutes, and people get impatient that you want to close down. And that impatience often leads to impulsiveness, and the impatience and impulsiveness leads to mistakes, and one mistake and corona is with you, and that is what we need to avoid. So I think all you need to do is take a step back, stay safe, and self protect. I think that is the need of the hour. Dr. Shetty, what do you feel? How do you feel to get that little mental attitude to take a step back and conquer the so-called impulsive impatient Indian? How can you control the impulsive impatient Indians?
I think I asked you a question as a thinker, so which was what was. But I completely agree with you as far as the state is concerned. But as a mental health professional, I would like to share this. Every disaster has a visible consequence and an invisible consequence, and the invisible consequence is the mental health consequence. We can mitigate it, prevent it by doing small things across life. And remember, if we can mitigate our invisible consequence, safety will also improve. People who are less anxious, more compassionate, equanimity and calmer will use safety procedures, so that is bidirectional. So I would say that this is not something which God will take it away. I strongly feel that all task forces across the country, different states, different cities, should should wire this thought again and again about the three gods, not Brahma, Vishnu, Mahesh, but as you said earlier, the mask, the distance, and the hygiene, repeatedly. Number two, sir, is what is very important also is to pass this message across influencers, so social influencers, not the only the WhatsApp and the Instagram influencers, but people who have a tremendous impact in the society. And that is something which we need to do. It's not only the politicians, we need to enroll a lot of others who will come forward as a movement. As you said, it has to be a movement. Number three, deterrence alone will not make people wear masks. Constable is gone and you remove the mask, it will not work. Along with deterrence, continuous cyclical education of the masses, and and saying that if we have to survive and we have to live, we need to do this for a long time. That is important. And lastly, there's a lot of social media videos around which people have really done good work. All governments should collate some of the beautiful videos and send a blitzkrieg across the country, because people are using a lot of Android and other phones, and see to it that a lot of positive messages spent. There's a lot of alternative guys in the country. There are yoga, there is meditation, and these guys, they're inspirationally doing a lot of things and sending. But India is a symphony without synchrony. So if the state governments can synchronize these efforts and really push it across the people, we might accelerate safety, we might accelerate health, and we might contain the coronavirus. So, Dr. Shashank, fantastic always, and Dr. Shetty, thank you for being there. I really thank Dr. Shetty also
Shetty,
for being
Guru Anna, you are our guru. So I must tell you that you have been simply awesome. And I think we have still not been answered. A lot of people are still complaining that we didn't answer all their questions. But I think we should do a Q&A session again, just answering their questions once more. But I think thank you very much. And I think it was wonderful. I think I think just took a break. We will have somebody else next Sunday coming up with us. And probably in midweek, we might just have a session where we'll again take Q and answer case, and we might even take patients who are actually living with corona, are survivors of corona. If they have question and answers, they want to join on our show. Maybe for 10 minutes we'll do that. We'll definitely try to integrate a better and a more interactive session, because that is what people want, and that is what we are here for. Thank you very much, and thank you, Dr. Shetty, for inspiring.
thank
You are
you, thank
inspirational role
you,
model
thank
for all of us. And Guru Anna, take care. And my appeal to everybody: stay safe, stay happy, and be cheerful and positive. You know, अपना time आएगा.
Thank you, Anirudh, for being there all the time. Thank you, guys. We'll see you again next Sunday, or even in the midweek if necessary. These videos will is always available on YouTube, and it would be nice if you guys share these videos with your friends, family, with your ex friends, ex boyfriends, ex girlfriends, and also with your foes and your enemies too. And that I think would be fantastic. Thank you. Thank you, Anirudh, for being there.